Hi guys, and today we have a very special guest, Dr. Rakshita, an ENT specialist recently passed out from MVG Medical College and Hospital, Bangalore. Thank you for joining.
Hi Shivam, thank you for having me.
So Dr. Rakshita pursued an MS in ENT, and today we will talk about managing NEET PG preparation along with MBBS. So let's begin firstly, like how should you manage your NEET PG preparation along with your UG studies? Like how should your focus be?
Shivam, I think it's important for us to understand how this whole parallel preparation of NEET with MBBS started. The idea was that the questions became more and more conceptual, and the professors realized that it's easier to start the coaching or the training right from first year, so that all the important concepts throughout and all the subjects which are important for NEET exam are kind of drilled into you and your conceptual logic, so that all the way after internship, when you do write the exam, these concepts are kind of concrete in your head and you find it easier to do your NEET exam. But my god, the amount of pressure that this thing has started, it's just students have completely lost direction to focus towards really learning stuff. Like, first of all, I think it's encouraging the whole cutthroat competitive mindset in people throughout MBBS. So it's like if I'm doing my MCQs alongside my MBBS training, I'm better than the rest of the class, and there's this whole psychological paradigm change that is happening in students. And I think, speaking from my specialty, surgical branches and pretty much everywhere, there's a whole concept of having team work. It's like I as a surgeon cannot operate if my nurse is not there, if the person doesn't come and clean up the stuff. You know what I mean? So it's not just about knowing the subjects. It's also about having very good people skills. It's also about having very good clinical skills, to be able to apply your theoretical knowledge in patients, in diagnosis, empathy, compassion. There's a lot of things that come together. And I think sort of putting a lot of pressure about focusing on just one exam throughout your MBBS curriculum will not help you a lot in your clinical practice later on. At the same time, I think it's also encouraging some negative aspects in a lot of students. So although it's a good thing to have parallel preparation, I think it's important to remember that one, you're just learning the concepts well, so that later on it can help you. So the comprehensive studying needs to be not to crack MCQs, to have numbers and keep doing exams and all of that. It's more about understanding the concepts and then moving forwards. One. And two, also to remember the fact that the whole way how these exams are conducted is to make sure that 2 lakh students is condensed down to the 20,000 for whom residency seats can be given. So every year, if more and more people learn the simple concepts and are able to answer, every year the level of questions will increase. At the same time, every year they'll probably keep changing the pattern as well, so that they can keep doing the filtering process. So there's a good chance that if you prepare a certain pattern from first year, you'll have to change it by the time you're in third year, and you'll have to change it again by the time you're in internship. So which is something that most of the students probably would find difficult. And the last and the most important thing, I think we also need to have medical students understand the importance of learning from failures. I think it's important to know that failure teaches you way, way more than success can ever teach you. So putting so much undue pressure on one exam throughout 5.5 years of a beautiful journey towards becoming a doctor, which for most of us was a childhood dream, I think it's just, it really doesn't make sense, at least in my opinion.
Okay, so that was a great explanation, I must say. You pretty much answered all the supplementary questions which I had lined up for this session, and I don't have much questions to ask. And I guess it was a lot motivating, inspirational, as well as a lot of things, a lot of notes to be taken down by the UG people. And that's how I'll end this session. Hope the audience found it a lot interesting. And thank you, Dr. Rakshita.
Thank you, Shivam. Thank you so much.